When I started doing rhinoplasty almost 50 years, exactly 46 years back, we had a very horrible looking cast that was on the nose, and it was extended to the forehead and was there fixed with a circular bandage. So this looked horrible, but this is the only thing which survived from what I have learned 46 years back. And this has two effects. First, it keeps the nose in shape, and second, it keeps the patient away from going too early in social life, because this looks horrible. Of course, it depends always a bit how much you are mobilizing the whole structures, but usually you need a good dressing and a good device to keep the nose in shape then. And therefore, I think you should stay away from sports. I think also you should stay away from smoking and drinking too much alcohol. I think one glass of wine is not the problem, but you should stay away from that. You should not talk too much. I think this is very important, that you should keep quiet. That I always said, it was more for loving, but you should not kiss too much, because always if you activate the mimic muscles too much, there is a chance of displacement. Therefore, I think you should do that. And you should sleep with a head which is a little elevated, so that you have an indirect drainage. And these are the most important and usual tricks or advices I give my patients.
First of all, it's nice that we have moved from the times of putting tampons in the nose. So I use elastic tubes. The patients breathe even in the recovery room. As soon as they wake up and they start appreciating their breathing, most of them, they declare already, yes, I can breathe better than before. And these tubes stay for 5 days, so immediately it's something that they need to be aware of how to clean and how to maintain the patency of the tubes, because their breathing is dependent on that. So we go on to the whole kit of how to clean the tubes with a special system, with salty water, with a little bit of oxygenated water, with syringes and special catheters, and they get to do that themselves. It's actually their obligation. Once the tubes are out, I do also advise in the immediate postoperative period up to a week to 10 days that they raise the head of the bed and they are inclined at 30 degrees because that reduces swelling, that they have a diet with reduced salt intake, again in order to reduce the swelling. I also advise them to go out and walk, even if it's only for a few minutes, because after general anesthetic, it's a stress to the body, it's a stress to the patient. You can also experience this psychologically, be in a lower mood and so on. And if you go out and walk and stay in touch with nature, this is something that helps your body recover faster.